Health Spotlight, presented by Community Health Network.
In tonight's Health Spotlight, understanding why respiratory illnesses are running rampant across the country.
Here to explain one possible reason is Wish TV's medical reporter, Dr. Mary Gillis. Mary.
Drew, Phil, flu infections are the highest they've been in 13 years, and hospital beds are overridden with babies suffering with RSV. I spoke with Dr. Sean Granis, Vice President of Data and Analytics at the Regenstrief Institute, who says one reason behind the soaring numbers is because the past 2 years, Americans experience what's called an exposure gap.
When people are exposed to the virus, their immune system develops a response to that virus. When we're vaccinated, our immune system develops protection against a particular virus. During the pandemic, a couple of things happened. Number one, there was a decrease in the spread of influenza, likely due to our social distancing, masking, etc. So we saw very much lower rates of flu over the last couple of years. So there was an exposure gap.
Granis tells me that social distancing and masking also led to an exposure gap with RSV, which is why cases are spiking compared to previous years. On top of that, many people fell behind on vaccines during the pandemic, especially the flu vaccine, which added to the exposure gap. Granis goes on to say the return on investment of getting a flu shot is significant. Human lifespan is higher now than it was a century ago. Part of the reason, he says, vaccinations. Reporting from the studio, I'm Wish TV's medical reporter, Dr. Mary Gillis.